Lovely.
And I'm Roger Steele.
Throughout our series, we have been identifying diseases diagnosed through medical imaging. Today, we are going to explore Ewing sarcoma. To begin, here's a brief overview. Ewing sarcoma is a primary malignant bone cancer, usually in long bones of children. It originates in the red bone marrow. There is no medically proven reason as to how it begins, but most patients have had a previous trauma to that area. Ewing sarcoma is also often referred to as PNET, which is a primitive neuroectodermal tumor. Ewing sarcoma was named after a man named James Ewing in the 1920s. He found it was different than other lymphomas and cancers. He dedicated most of his life to the research of cancer, and sadly, he died of bladder cancer in the 1940s. Now to you, Roger.
Thanks, Veronica. The affected bones are usually long bones of the legs. The pelvis is also very affected by Ewing sarcoma. The combination of the bones of the leg add up to about 35% of affected bones. 24% of all Ewing sarcoma is in the pelvis. Now to our correspondent on the street corner, Kelly Ross.
Thanks, Roger. It's been found that Ewing sarcoma makes up 5 to 10% of primary bone tumors and is the second most common cancer in children and is also the most lethal bone cancer. It affects about 2 children per 1 million internationally. Usually affects children within the ages of 5 and 15 and rarely affects people over the age of 30. It occurs with rapid bone growth, so children experiencing puberty are more likely to get this disease. It's also perhaps why more men than women are infected. This disease also occurs more in Caucasian children than Asian and African Americans. Also, it should be known that Ewing sarcoma is not hereditary, so siblings of those affected by this disease are not more common to get it. Back to you, Roger.
Thanks, Kelly. Really looks like you're earning your payout on that street corner. Symptoms of Ewing sarcoma vary among people depending on the size and location of the tumor. In most cases, pain, swelling, and tenderness are the most common symptoms presented in the affected area. Most patients complain of pain as the initial symptom, which tends to be intermittent at first and increases in severity with time. In addition to pain and swelling, many symptoms may be present, including erythema or warm skin around the site of the tumor, fever, weight loss, decreased appetite, fatigue, and anemia. Numbness, tingling, and paralysis may also result if the tumor is in the spinal region. Ewing sarcoma has also been known to affect the central nervous system. The most common sign of Ewing sarcoma is a palpable, tender mass with increased vascularity surrounding the tumor. Leukocytosis, porous bone, and fractures are also associated with patients. Usually consult a doctor due to the regional pain alone or in combination with a palpable mass.
Hey everybody, this is Phil from Orno Car Care. Every day we rebuild every make and model of vehicle. We can't make them new again, but we can make them safe for your family. With our easy financing, we can get anybody in a car for a low monthly payment. To see how easy it is, come on down to Orno Car Care and come join the party!
And we're back. We were lucky enough to catch up with Dr. Schlakovich, an authority on the diagnosis and radiological findings of Ewing sarcoma.
A complete medical history and physical examination is done to determine the extent of the disease. Examination commonly includes blood tests and diagnostic imaging such as X-ray, CT, and MRI. As you can see on this X-ray, the lesion is lytic and central. It also appears to have a moth-eaten look, which is a more advanced sign. If it was earlier, it would have an onion peel periosteal reaction along with a soft tissue mass. Here, as you can see, is the more moth-eaten and mottled. Now, when doing X-rays, the technique must be adjusted properly to demonstrate the disease at its various stages. Early in the disease process, the bone becomes thicker due to lesions. With the increase in density early on in the disease, the kilovoltage needs to be increased 5 to 15% in order to properly view the tumors. Later on in the disease process, the bone will start to deteriorate. With the deterioration of the bone, the KV must be decreased 5 to 15% in order to visualize the bone correctly. However, the KV is only decreased once 30 to 50% of the bone has deteriorated. Also, X-rays can show whether it's benign or malignant. So, if the X-ray is not demonstrating enough information, we can also do CT or MRI. However, blood tests also demonstrate Ewing sarcoma with an elevated level of LDH or lactate dehydrogenase. If there is a positive blood test, a tissue biopsy or bone marrow aspiration should then be performed. From the biopsy sample, there should be tests including immunohistochemistry, cytogenetics, or reverse transcription polymerase chain reaction. With immunohistochemistry, the sample is treated with antibodies to identify substances that are found only in Ewing sarcoma cells. With cytogenetics, a microscopic examination of chromosomes from Ewing sarcoma cells reveals translocations from chromosomes 11 and 22, which distinguishes it from other types of cancer. And finally, with the reverse transcription polymerase chain reaction, it is a way to identify translocation using chemicals instead of a microscope.
Thank you, Dr. Slovowicz. And now to Veronica with the progression of Ewing sarcoma. Veronica?
Thank you, Roger. Ewing sarcoma is a systemic disease, which means it can be very aggressive. The two stages of this cancer are localized and metastatic. Localized means that it's still in the same area it originated in. Metastatic means it has spread. Ewing sarcoma spreads when the tumor cells enter the bloodstream or the lymphatic system. Lungs and other bones are the most common secondary sites. Biopsies are taken at the site and are the only way to truly diagnose Ewing sarcoma. Now to you, Dr. Crepair.
There are three main treatment options for Ewing sarcoma: chemotherapy, radiation therapy, and surgery. In the United States, the most common treatment starts with chemotherapy. It's done for 2 to 4 months, and then different radiographic studies are done to see if any progression has been made. After that, a course of radiation therapy is commonly done. Where chemotherapy is a systemic treatment, radiation therapy is directed at the actual cancer tumors. Surgery is the most preferred method of treatment, where the tumors are localized and they can be taken out without further damage to the surrounding tissue. If the whole limb is involved, then limb-saving procedures are now effective in saving the limb while treating the cancer. When surgery is performed, we often use bone grafts. If the bone graft comes from the patient themselves, it's called autogenic. If it comes from another source, freeze-dried or frozen, it's called allogenic. But ultimately the goal in any treatment is to get those little monsters on their feet, causing mayhem. So, for all your pediatric care, please call Dr. Crepair.
Oh, don't you just love that Dr. Crepair? I bring all my children there. Now to Claire Bell with Prognosis and Remission.
With the advancement of chemotherapy treatments, recovery from Ewing sarcoma has greatly improved over the years. The prognosis depends on several factors, the most important being the size and location of the tumor and whether or not it is metastasized. Patients with smaller localized tumors or those that are easily removed through surgery will ultimately have greater survival rates than those in which the tumor is large and is metastasized. Other factors have also been determined to increase survival rates for patients with Ewing sarcoma, including age, overall health of the patient, gender, and the tumor's response to therapy. Also, elevated LDH levels prior to treatment also indicate a poor prognosis because there is an increase in tissue breakdown from the rapidly growing and producing tumor cell. In patients with localized tumors only, survival rates in children younger than 15 have a 5-year event-free survival, or EFS, of 76%. For children 15 to 19 years old, an EFS of more than 5 years is 49%. Once a tumor has metastasized, the event-free survival rates drop dramatically depending on the extent of the metastasis. As with many cancers, reoccurrence of Ewing sarcoma is possible. The patient population often requires extensive treatments and can have a poor prognosis. Chemotherapy and radiation treatments can also cause late effects to develop after successful treatment of the tumor has been completed. There is a risk of developing secondary cancers or leukemia from these treatments, so close monitoring of these children is important throughout their lifetime. As with most cancers, early detection is the key to successful treatment of this disease. With the remarkable advancements in chemotherapy treatments and surgical procedures, the prognosis for these children has greatly improved throughout the years. Back to you, Veronica.
Thank you, Claire. This was a special edition from PKM Broadcasting. If you would like more information, contact the 3 people that did this report. Farewell, good day, and as always, stay classy, my friends.